How do CORT scans show specific COPD lung damage types? Imagine being able to see inside your lungs without any cuts or incisions. That's what a computed tomography scan does. It uses X-ray technology to create detailed cross-sectional images of your lungs. These images help doctors spot exactly what kind of damage COPD has caused. COPD, or chronic obstructive pulmonary disease, mainly damages the tiny air sacs called alveoli and the small airways. When these structures are damaged, it affects how well you breathe. On a CORT scan, areas of emphysema show up as regions of low density or low attenuation. This means parts of the lung look darker because they are filled with air instead of healthy tissue. There are different types of emphysema. Centrilobular emphysema is common in smokers and appears as small, well-defined dark spots near the small blood vessels inside the lung lobules. These spots are usually found in the upper parts of the lungs. Panlobular emphysema affects the entire secondary lobule, leading to more widespread low-density areas. Paraseptal emphysema shows up near the edges of the lungs, especially close to the chest wall, and appears as larger focal dark patches. Small airway disease is another key feature of COPD. On a CORT scan, this shows as thickened airway walls and fewer small airways. Early in the disease, doctors might notice fewer terminal bronchioles, which are the smallest airways. During an expiratory scan, which is taken when you breathe out, areas with small airway disease can trap air. These regions look darker because they do not empty properly, a sign of air trapping. Advanced techniques like densitometry help measure how much lung tissue has been destroyed. This involves analyzing the density of different lung regions to quantify emphysema. Parametric response mapping compares images taken when you breathe in and out, helping to distinguish between emphysema and small airway disease. Texture analysis looks at patterns in the images to assess inflammation and airway remodeling. Using CORT scans in COPD diagnosis gives doctors a clear picture of what damage has occurred. It helps identify the type and extent of emphysema, shows airway changes, and tracks disease progression over time. This detailed view guides treatment decisions and can even predict how the disease might develop. So, in essence, CORT scans are like a map of your lungs, showing exactly where and what kind of damage has taken place, making them a vital tool in understanding and managing COPD.